Hi, my name is Haleigh Cowdrey, and I am a certified surgical tech and certified surgical first assistant. And this is my video for the brand program. I'm going to get started with discussing a time where I experienced an unethical behavior. Um, just finishing up my in person semester in Casper last year, I noticed a big difference in current students today with all the available technology to them, especially all your AI stuff and your chat GTP that everybody always hears about. And I noticed some of my classmates were starting to kind of push the envelope on what would be acceptable on how to use those forms of technology. And so I started to invite a lot of my classmates over for study groups so that we could kind of dial back on the use of technology and just get back to the basics of study groups and working through problems together and all of that kind of stuff. And it really had a positive impact. I had a lot of people that would show up, and I'd make dinner for people, and we would get a group about 5 or 6 of us, especially for my chemistry class, and we would work through problems together. And we would even have lockout sessions for our phones. And so it was just really nice to put pen to paper, and we had whiteboards and kind of to just dial back on the technology and get away from, like I said, they were kind of pushing the envelope on what was acceptable for how they would use those platforms. And so it was nice to kind of be able to bring them back away from that and work through things together. In May, I will have been working in healthcare for 10 years already, all in surgery. And surgery takes a team effort every single day. It's one of the most complex places I feel that you can work in the in the hospital system, especially when it comes to a team because there's so many moving parts. You have your surgeon, your anesthesiologist, your nurse, your tech. A lot of times you have an assist or a PA or somebody else. You have a lot of students a lot of times. And so working together as a team to be able to provide the best care and outcome for the patient is really important. Um, we just always want our patients to have the best outcome. And so we always are just very effective in our communication. And everybody's goal is to have the best outcome for that patient. And so I've always enjoyed working in the operating room and the team atmosphere that you have there. And so I just really enjoy the operating room, like I said, and it's just a really good team environment there. So, some unexpected feedback that I received was just a few months back. We had a patient that coded in the OR, which is actually more unusual than you would expect, just because usually our patients are intubated, and unless it's a trauma, you have to be pretty well clear to be able to have surgery. And so it's not very often that we actually have to run a full true code in the operating room. We had one a few months back, and even through the whole stressful situation, and we had a brand new nurse on orientation that night. It was her first night taking call. Received feedback back from the surgeon, and I was very unexpectedly. She talked about how well we all did and talked about each of us individually. And for me in that instance, she talked about how well I did with helping the anesthesiologist. He became my main concern during that code because the patient had a lot of stuff in their airway that we were trying to suction out and get out of their airway. And he was really struggling. And so my main focus was on him, and he asked me just to stay there with him and not go anywhere and just be basically his assistant in that point in time and let everybody else deal with the compressions and the meds and all of those things. And so she gave me a pretty good shout out and feedback for just staying attentive to him and to doing whatever he needed, which as a surgical tech is a little bit outside of our comfort zone just because a lot of times we are more hands-on with the patient in other ways. The anesthesiologist usually is kind of on their own. They deal with their stuff pretty well, or a lot of times the nurses will help them out because they are the ones that are ACLS trained. We do have our BLS. Everybody, as you know, has to have it in healthcare, but just having that feedback from her was very nice to hear that she thought we all stayed very calm and collected and did whatever we could to help this patient in a very stressful situation. Another thing that I wanted to touch on with the unexpected feedback from the surgeon was just that I was just impressed that she took the time to even realize what everybody was doing in the room. During those stressful situations, our patient is our main focus. And so for her to be able to come back and tell us all individually what she noticed of us in that stressful situation was just very appreciative. She made us all feel like we were noticed in our team and during that situation, which by the end of the day, with that code, I think there was probably 15 to 20 people in the operating room with us that was helping because we ended up flying that patient out. So between the flight team, we had ICU nurses in there, we had managers in there, house supervisors, all the things. There's so many people. But at the beginning, it was just the three of us, four of us. It was a call case, one of those instances where we don't have a fully staffed OR. It's just you and your nurse and your doctor and your anesthesiologist. And then we were lucky to have another nurse on hand because she was orienting. But for our doctor to take the time to notice all of us and what we did in that situation, that pleased her and impressed her, and for her to take the time to give that feedback was just made you feel good. It made you feel like you really are part of that team. It makes you feel like your work with that patient in that stressful situation did not go unnoticed. And so it was very nice of her to take the time to do that and for her to even just notice it in the first place, because in those stressful situations, there's so much going on that at the end of the day, she could have just said, yeah, everybody did a good job. But she was able to sit there and tell each of us individually what we did that impressed her and that she was happy that we were there. And so that's just nice to hear that she was glad that it was us that was there with her and that she took the time to show us that appreciation. As a surgical tech, you definitely have to have some strong communication skills, as I feel anybody in the operating room needs to have. When we're scrubbed into surgery, we can't, leave the room to go get things that we need or even go with our nurse to explain where stuff might be at. And so we really need to have calm and clear communication skills to be able to let them know things that we're going to need, especially if it's something where we're in a trauma or we're in a high stress situation where you might not always know what you're going to need beforehand. And so being able to just stay calm and clear and really give them good directions if they don't know where something's at that you need, so that you can direct them to it with your words, because that's all you have at that point in time. I can't leave the room to go help them. I can't leave my surgeon and my patient behind to scrub out and go find this and come back. And so I really need to have strong communication skills and being able to talk them through. I've had a lot of nurses say that they like when I scrub with them because I am able to calmly tell them with very detailed instructions where they can find something, because there's nothing that's worse than when we're operating and our nurse has to go find something and they're gone for a long time because they're not sure where it's at. And then there's other things that come up that we need, or something more dire comes up that we need, and we have no way to get a hold of them at that point. Like, we're at their mercy of them coming back to us. And so I pride myself on being able to communicate with my nurse very effectively on where things are at, what I'm going to need next, what the surgeon's going to need next, so that we can be one step ahead, so we can be prepared, so that we can get our patient out of the operating room with the best outcomes. Getting accepted into the brand program would help me to be able to achieve my career goal of getting into nurse practitioner school and being able to be a provider for the Wyoming community. As everybody who is from Wyoming or has lived in Wyoming for a long time knows, it can be tough to have local providers that can provide extensive care to people. My goal is to be able to provide for my small rural community without them having to travel somewhere out of the community to have their care. My end all goal is to be able to do hormone therapy and like a family practice of my own, and be able to provide that for my community. And so getting accepted into the brand program is going to help me on that career path to be able to then get into hopefully nurse practitioner school through the University of Wyoming, and then be able to be a provider to my community. Um, the brand program is really going to help me to achieve that goal, to be able to have the accelerated program and to get my bachelor's and then continue on with my schooling. It's definitely the best opportunity for me to be able to get my schooling done and still be able to work right now, to be able to provide for my patients now as a first assist. I'm very excited to be able to start that path as well, as I just finished that schooling and I start next week with my new job and my new providers. And so I'm looking forward to be able to be more hands-on with my patients than I already am now. And the burn program will be able to help me to then also become even more hands-on after that. And like I said, then I want to continue on to nurse practitioner school to then become a full-on provider for patients in my community. I really enjoy Wyoming. I love living here. I've lived here now for almost 10 years, and there's nothing more that I want to be able to do than to give back to my small Wyoming community and to become a provider for them someday. I want to thank you guys very much for your time and considering me for the application to the brand program. I look forward to hearing from you guys and hope to get started with you in June and show you guys why I want to be in this program and that you made a good choice in accepting me. Thank you.